Hello guys, so in this video we will talk about aplastic anemia and pure red cell aplasia. So, silang dalawa guys na belong sila sa disorders na tinatawag nating hypoproliferative disorders. So, hypo meaning decrease, proliferation meaning yung pag-produce niya guys. So, mababa dito yung production. So, kapag sinabi nating aplastic anemia guys, A meaning absent, plastic or plasia is meaning formation. So, meaning absent yung formation. Yung cause natin guys dito is more common na autoimmune destruction of hematopoietic stem cell. So, yung nai-involve natin dito guys is hematopoietic stem cell. So, since alam naman natin guys na yung hematopoietic stem cell nag-give rise sa iba't ibang klase ng ating cell lines which involve the RBC count, the WBC line, and the platelet line. So, lahat yan apektado kapag nasira si HSC. Yung mechanism niya guys is not fully understood, but they believe na ang nangyayari ay si hematopoietic stem cell nag-express siya ng natawag nating non-self antigens. Pag sabi natin non-self antigens, meaning idinedetect siya ng ating katawan as a foreign. Ngayon na-atakihin siya ng ating immune system. So, it will lead to the destruction of hematopoietic stem cell. So, kapag sira yung ating hematopoietic stem cell, therefore, decrease din yung production ng ating RBC, decrease din yung production ng ating platelet, and decrease din yung production ng ating WBC. So, if it happens na decrease yung production ng mga ito, kung decrease yung production ng RBC, the tissue cannot oxygenate. Oxygenate ito guys, nagkamali lang. So, nagtatry si body na mag-compensate ng oxygen by pumping the heart harder. So, pinapump niya ng yung ating heart para ma-increase yung cardiac output to compensate to the oxygen that are being cannot be produced. So, kapag ka nag-compensate si heart, nagkakaroon tayo ng symptoms like chest pain and shortness of breath. Yung other name ng shortness of breath, sinatawag natin dyspnea. Okay? Decrease din yung platelet kasi naapektuhan din natin yung platelet na cell line. So, pagka mababa yung ating platelet, there are increased risk of bleeding, kahit na minor injuries lang. And then, yung mucosal areas, yung most common na nag-bleed, like gums, or di kaya nose, nostrils, nagbi-bleed siya guys. So, ano ba yung mga causes ng ating aplastic anemia? Most often in idiopathic. Pag sinabi natin idiopathic guys, unknown. Meaning, hindi natin alam kung ano yung cause ng ibang aplastic anemia. Pero kung acquired siya guys, at it may be because of the radiation or toxins, most common is the benzene. Kapag drugs naman guys, yung mga chemotherapeutic agents, madami pang iba't ibang klase ng drugs guys, like parang thyroid drugs, it also causes aplastic anemia. And then the antibiotics, the most common is si chloramphenicol and si sulfonamides. So both of them guys are antibiotics and they causes aplastic anemia. Aside from that, mga infectious agents like viruses na Epstein-Barr, sabihin ko guys si Epstein-Barr virus. So, ito si virus na ito guys, siya yung nagkakos ng natawag nating infectious mononucleosis. And then si HIV naman, yung human immunodeficiency virus. So, dito din guys, nagkakaroon din tayo ng aplastic anemia. And yung another cause guys is clonal or genetic disorders. So, meron tayong tatlong types dito guys. So, yung una is the Fanconi anemia. Fanconi's anemia. Next naman guys is the dyskeratosis congenita or dyskeratosis congenita and Shwachman-Diamond syndrome. syndrome. Okay? So, ito yung ating mga inherited na aplastic anemia. So, first is si Fanconi anemia. Fanconi is the most common na inherited. So, yung problema natin dito guys, yung ating, kasi I think for example, yung itsura nating chromosome. Sa end ng chromosomes, meron siyang cap or yan, natawag natin siyang telomeres. Si telomeres na yan guys, nagsisilbi siyang buffering zone ng pag-replicate. So, dyan palang nag-load yung replication, tapos yung ito, dito na start mag-code. So, kapag walang telomere, dito siya nag-load. So, may mga part na hindi hindi na siya na-replicate. Kasi nga, dito siya mismo nag-load na imbis na pa dito. So, yung problema dito guys, sa ating Fanconi anemia, nagkakaroon tayo ng shortening of telomeres. It is actually involved the gene called FANCA. There is a mutation sa gene na FANCA. So, yung characteristic ng ating Fanconi anemia, it leads to pancytopenia, meaning all cell line is decrease yung RBC, so meron tayong anemia, decrease yung WBC, so meron tayong leukopenia, at decrease din yung platelets, so meron tayong thrombocytopenia. So, all cell line is decrease. So, pan meaning all, cyto meaning cell, penia meaning decrease. And then, meron tayong predisposition to malignancy, and makakakita tayo ng physical abnormalities like short stature, microcephaly, meaning yung back ng part ng head ng PB is lumiit, and then developmental delay, so hindi siya lumalaki, and then cafe oil lesions, so maraming pigmentation, para nagkakaroon ka ng balat-balat, and then yung absent or hypoplastic na thumb, or yung thumb is absent or di kaya maliit. Next naman is the dyskeratosis congenita. This is very rare. Yung problem then is short telomeres. It can be inherited by autosomal dominant or recessive or X-linked recessive. So, yung patient natin makakaroon na siya ng skin pigmentations. Next naman is a Shwachman-Diamond syndrome. It is inherited autosomal recessive. And meron tayong neutropenia, anemia, thrombocytopenia, or basically pancytopenia. Dito guys, decrease yung ating pancreatic enzymes, and meron tayong skeletal abnormalities, and increase yung ating risk for infection. So, sa ating CBC guys, para makakita tayo ng aplastic anemia, lahat ng cell line is mababa. Then, normochromic, normocytic, meaning normal si hemoglobin, or si MCHC, MCHC, and normal din si MCV. And mababa si retic count kasi may problem sa production sa ating bone marrow. Increase bone marrow activity. So, sa ating bone marrow, makita natin na hypocellular siya at na-accumulate siya ng fat. So, paano ito siya tinitreat? By transfusion, immunotherapy, and bone marrow or stem cell transplant. Okay? Next naman guys, let's talk about pure red cell aplasia. So, isa rin siyang Hypoproliferative Disorder. So, yung problema dito guys is absent din yung formation. Pero yung involved niya lang guys is RBC. So, sinabi nga na pure red blood cell daw. Pure red cell aplasia, meaning red cell lang yung involved. Hindi na natatamaan yung ibang lineages. So, RBCs lang, and RBC precursors lang yung mababa. So, it can be acquired or congenital. Kapag acquired, idiopathic din yung cause, meaning unknown. Pwede ring autoimmune or secondary to tumors or infection or drugs or viruses. Yung pinaka-hero natin virus is si FARBOV19. Okay? Yung congenital naman natin guys, meron tayong tatlo. Diamond Blackfan anemia. It can be inherited as autosomal dominant, and then makakakita tayo dito ng bone malformation. As a congenital dyserythropoietic, sorry, nagkamali ng sulat. Basta poietic yan, guys. Anemia. So, kapag sabi natin this, meaning abnormal yung production ng ating red blood cell. So, ineffective erythropoiesis. And it can be inherited by autosomal recessive. And then yung anemia of chronic disease, so sila yung ating kidney, hindi tayo makapag-produce ng EPO. So mababa din yung ating production of RBCs. Yun lang.